So today we are going to discuss about a slightly unusual topic on myths, beliefs, rituals, and child health. I thought rather than speaking about medical topics all the time, we are going to talk about some common beliefs and rituals and myths which are available in our community, how they affect the child health, and how as doctors we can give a scientific rationale for those beliefs and see whether we can do something good for our children. Right? So before we go to the lecture, I would like to give some definitions about what myths, rituals, and beliefs are. So a myth is a story or explanation of an event in the past which involves gods, demigods. Demigods means half gods and mythical creatures. Right? So the most loved myth is the story about dragons. Okay. And I still believe that dragons are there. As children, we loved myths, and if you have a child or a grandchild, please don't tell them that there are no dragons. Myths are important for the child health. Right? So when you have myths, they believe in something. They like to learn about creativity, and they will be enthusiastic about finding some mythical creature. So those are all important for your brain growth. So never tell a child, a growing child. Maybe later on he might realize that it's a myth, but for a growing child, myths are important. Then what is a legend? There are storybooks on myths as well. Right. So what is a legend? Legend is similar to a myth, but it's a folklore involving bravery and power where a human is the main character. So myth is a god, in a legend, human. So the most famous legend is Achilles. Right? So there are a lot of stories about Achilles. And another legend who came recently to our lives, where as children we grew up together, is Robin Hood. Okay? So legends and myths are very important for children. Okay? Then comes folk tales. What is a folk tale? Folk tale is an imaginary tale which have come down the generation as an entertainment element. Right? And one of the famous folk tale is Jack and the Beanstalk. Okay? And it's so famous that even adults love that because we have films on Jack and the Beanstalk. Right? So myths, legends, and folklore, they are very important for child health and development. As a pediatrician, I would encourage, if you have children, encourage you to involve them in these three topics. Right? They are not real. We don't know. Actually, may never have existed, but still, it's good for the development of a child. So what is a belief now? So we have come through myths, legends, and folklore. Now we have beliefs. Beliefs is a subjective attitude that something is true even without evidence. Okay. So there are religious beliefs, cultural beliefs, historical beliefs, philosophical beliefs, and political. I'm not going to touch on religion, history, philosophy, and especially politics because that is not within the scope, but culture. So cultural beliefs on parenting is very important because these beliefs deeply ingrained and passed down through generations, right? And it impact the parenting styles and ultimately affecting the child's development, discipline, communication, and expectation. So today we are going to talk about the cultural beliefs on parenting and child health. We will leave religion and politics for another day. Then what is a ritual? Now, when you have a belief, you need something to overcome the belief or to help to get a solution. So it's a repeated structured sequence of actions or behaviors that alter internal or external state of an individual or group. Right? So these are very high-fi terms. We will come into that with live examples. And again, rituals, there are religious rituals, cultural, historical, political. So again, we are going to concentrate only on cultural rituals. Right. So why do we have beliefs and rituals? What is the reason we have beliefs and rituals in our culture? Because always there will be problem, and most of the time the cause for the problem is unknown. As humans, in general, we like to know the cause for the problem. We don't like problem to be unsolved. So we seek help from seniors. And what is the problem with seniors? Seniors also don't know the reason, but they don't like to admit that they don't know. Right? For example, I am also a consultant. When a medical student asks a question where we don't know, we get a little bit uneasy. So the common getaway is you will say, oh yeah, that's a good question. Why don't you do it as a homework and discuss tomorrow? So that we also have time to go back and discuss. Or we have the boomerang effect. You ask a question, you don't like to admit that you don't know. So you will boomerang it to another student. Why don't you answer the question? Right? If we can't, you will say, you do it as a homework and tell us tomorrow. Right? Okay. So and our seniors did not want to know, want to tell that we also don't know. So because of that, they came up with beliefs, myths, and rituals. Right? So I have divided beliefs and rituals into 4 groups. This is a division which I made. I don't know whether it's correct or not, but it looks okay. Right? So BNR is beliefs and rituals. So there are beliefs and rituals where there's an acceptable rationale with a positive effect on a child. Example, we have in our culture, we have a common thing that do not get wet in the first rain of the season. You will fall ill. This is a very scientifically stable belief. Right? With the first rain, all the chemicals in the dust and air will come down to the earth. And if you get exposed to the first rain, yes, there's a scientific evidence that you might get ill. So this type of belief, we should let it be because it is giving positive effect on a child. Then belief with unacceptable rationale but positive effect on a child. Don't eat late night. Worms will feed on your food. There's no scientific rationale. If you have worms, they will feed during daytime as well as night. But because of this belief, people will not promote children to eat at night, which is a good thing on children because eating at night leads to obesity, dental caries, and poor sleep. Right? We don't expect our children to get up late at night and start eating. Right? So this is an unacceptable rationale, but with a very good effect on the child. So we'll let it be. Then you have a belief where there's an acceptable rationale, but negative effect on a child. For example, coffee is given to reduce postpartum hemorrhage in mothers. There's a scientific explanation. Coffee is a vasoconstrictor. So yes, you can get reduction in postpartum hemorrhage. But unfortunately, when you give coffee to the mother, it can go through the breast milk and the baby can become irritable and the maternal dehydration can cause reduction in milk flow. So acceptable rationale, but negative effect on the child. So we have to prevent this type of beliefs. And there's the 4th group is unacceptable rationale with negative effect on child. I don't have space to write plenty. So we are going to discuss on those rituals. So as doctors, as first contact doctors, if we come across beliefs and rituals during our practice, number 1 we need to do is we have to respect age-old beliefs. Right? We are not going to blindly say no to every belief or ritual because they have been passed down generation for a long time. Explore the rationale and the effect. If it is harmless, let it be. If it is harmful, you have to scientifically explain in lay terms. Convince about the harm to the child and discourage the specific belief and ritual. Now, our explanations, these are common examples of our explanation we give to parents. Febrile fit, recurrent upper respiratory infection, samanya. Blood test on day 1 of mild fever, febrile fit, right? So these are our blunt explanations we give to the mother, and parents are never satisfied with this type of explanation. Right? What is missing in this? You say febrile fit by Nepal, the parents again come back another day to the private sector and say, we have a child with febrile seizure. Spiritual Cuba by Nepal. What is the reason? One element is missing. Scientific element is not given in lay term. That is correct. The second thing, very important, we say bio Nepal. Why should I not do it? Why calculate? Right? Recurrent respiratory infection is samanya. Why is it? Why is it common? Right? Blood test on day 1 is not needed. Why? You are not telling why. Make it a behet na. Why there's? Because it's not a disease. Febrile fit is a reaction to the fever. It's not a disease. Therefore, no point in doing EEG or brain scan. Therefore, there is no drug. We don't tell that part. We just say make it a behet. Right? So why component is very important. So we are going to use this why and explain some of the beliefs and rituals. So again, I have grouped them into 4 groups: neonatal and infant care, child development, foods and feeding, and disease. So I like to start with a real life experience. I was a registrar. My first year registrar was at Ratnapura. We got a 6-day-old baby in opisthotonus and deep icterus. Parents thought yellow color was due to tamarind. In their culture, in Ratnapura, in some areas, they apply tamarind all over the body as an antiseptic. Okay? And these parents thought that the baby is becoming yellow due to tamarind. A very reasonable explanation. But then when they found that the baby is not feeding, having fits and opisthotonia, they brought the child on day 6. And unfortunately, we did 2 exchange transfusion. The baby did not recover from the kernicterus. He ended up with chorioathetoid CP. Okay? So, a very simple ritual leading to cerebral palsy, which is totally preventable. Herbal baths are very common in Sri Lanka. The most common agents we use is Venival, tamarind, kokumpotu, and neem. Neem is kohomba. The rationale is correct. They are antibacterial and it has a very soothing effect on the baby. Right? But the only problem is, especially Venival and tamarind, they can cause yellow discoloration in skin. So as practitioners, what we can say is, we can't say don't use anything, right? That because there is a scientific rationale. What we can say is, okay, better to avoid it during the first 2 weeks. Because if the baby becomes jaundice, we will not be able to pick it up. Right? After first 2 weeks, you can apply. There's no harm baby becoming a little bit yellow after 2 weeks, because it will not mislead us with jaundice. Okay? So very important, because a lot of communities, they use Venival, especially Venival and tamarind as antiseptics for local application. So, then second belief, very common, is Galkiri or witch's milk. Right? Whenever a baby is born, the grandmother is so much interested in the baby's breast to see whether there's milk engorgement, and they will always try to express it. There's a scientific rationale, because when the mother has milk engorgement in the breast, it is very painful to the mother. So the grandmother might think, yes, if it is painful for the mother, then it must be painful for the child. So they're actually doing something good for the child by squeezing the milk out. Breast engorgement is not painful for neonates. Okay? But by trying to express it, you can cause pain, real pain to the child. Most children end up with breast abscesses. This is not only common in Sri Lanka. There are other countries where this practice, witch's milk practice, is there. There was a study in Bengal involving 352 mothers. 40% practiced squeezing of the newborn breast, and 39% ended up with mastitis. Another 15 with breast abscess, and 35% with sepsis. So it's a practice which we should try to avoid by explaining that newborn breast enlargement does not cause any harm to the child, any pain to the child. Automatically it will resolve. If you tell that part only, they will understand. If you bluntly say, don't squeeze the breast, they will not believe, because they don't know why. They are just trying to do something good for the child. Okay. Then, mother of all beliefs. Every newborn with jaundice has a feeding issue. Whenever a child becomes yellow in color, mother gets anxious, because they think, okay, it is always due to a feeding issue. The rationale is lack of feeding is one of the cause of pathological jaundice. So that's a correct rationale. And most babies with feeding issues, unfortunately, have physiological jaundice, which has nothing to do with the feeding issue. Right? So some babies are physiologically a little bit jaundiced, and they will have feeding issues. And the mother thinks this jaundice is due to my feeding issue. Okay? And we as doctors also help this belief, because indirectly we fortify the belief. The first question we ask, the reflex question, when we see a child with jaundice, is we ask, are you feeding properly? And immediately we are giving an idea to the parent that feeding is the #1 cause of jaundice, which is not. Right? So if you are a practitioner, if you are dealing with a child with newborn with jaundice, don't ask feeding as the first question. Ask about the blood group. Ask about the thyroid test. Right? Ask whether there are fevers or sepsis. Then the mother will realize, there are other causes for jaundice. Because what is the main thing about Sri Lanka? Whenever a child becomes yellow, mother take the blame. Right? The child is becoming jaundice due to AB or incompatibility. The actual culprit is the father. because mother is O positive, father is B positive, baby is B. Father gave the blood group to the baby, so the actual culprit is father, but mother takes the blame. Right? The baby is having jaundice due to sepsis, mother takes the blame. The baby is having jaundice due to physiological jaundice, which is completely harmless, mother takes the blame. Right? So we have to, as practitioners, tell the parents that there are so many causes of jaundice, feeding is only one cause. Then infants. When it comes to infants, there are two very common myths. The baby's clothes should not be used, washed using a washing machine. Actually, an engineer asked me, he had a 6-month-old baby, is it okay now that we put the clothes to the washing machine? Right? They think if you put the clothes to the washing machine, because the washing machine has a action where there's rotation, and baby will also struggle because of that. Baba ambrani ready ambrani. Very acceptable rationale, right? But it's common. Still in practice, right? Engineer asking that question in 2025. That means how strong this belief is. And then the common balagiri dose, right? So, lot of children cry without, very children like at the age of 2 to 3 months, they start inconsolable crying where you can't settle them at all, even with feeding. And the common belief is Balagiri Devi or Balagiri Akshani comes and hit the baby and go. Right? So, is there a Balagiri Devi? There's a huge myth about Balagiri. Even now we see this Balagiri Dosha Adhanave written in, right? People think Balagiri is a fool, so she come read it and then come back again, right? So, the real reason for this Balagiri dosha is infant colics and gastroesophageal reflux. Okay, so whenever there's excessive crying and inconsolable crying, we call it Balagiri devil. And because of the colics, baby has vigorous writhing movements, and people attribute it to cleaning clothes. Again, see, the mother is blamed. Mother is the one who is washing the clothes. Right? The reflux symptoms and evening preference, arched back, red face, rumbling tummy, because it happens in the evening and with these clinical features, the only explanation is devil has done it. Okay, so we'll talk a little bit about devil. So Balagiri is an ancient princess who committed suicide after being raped by her brother. And parents were actually warned about this raping case, and they tried to prevent it by hiding her in a cave, rock cave. That's why she's called Giri Devi. And after that, she became goddess and devil with 12 versions. Every month, there's a devil coming to hurt the child. So I found 11, but couldn't find the 12th one. So Madanagiri attacks the baby on first month, Hapamalgiri at second, Balagiri at third, Molangiri, Bhutagiri, Nilagiri, Ratnagiri, Hanungiri, Pattagiri, Kotagiri, Hanungiri. Right? So these are the Giri Devis who will come and attack your child during the first 12 months. If you can find the 12th Giri, please let me know. The harm is there will be multiple rituals, herbal smoke, yantra, trying certain flowers in the infant's wrist, which all delay in seeking medical help. For example, this is what you have to do if you want to chase the Balagiri away. I'm not going to read all the things, but see these blue things. Nivasatula Dumellim, Sambrani, Olindamul, Nai Haver. Right? And to fortify it, Ratana Sutra has also been, right? Now the people will really believe, oh, no, this is the correct thing. Right? So actually you don't have to do all these things. These are all going to create trouble. We need to treat. But then what problem is, even in Western medicine, there's no proper treatment for infant colics. Right? No drug of choice yet. It is believed that omeprazole is somewhat better than domperidone. But unfortunately, omeprazole syrup and tablet is not available in Sri Lanka, only the omeprazole capsule. So you will have a hard time counting the pellets and finding the dose. Probiotics are commonly used for reflux. Again, no strong evidence yet. Simethicone, harmless but effective only in some cases, especially for gaseous, distension of stomach, not for the reflux. Right? But it's very harmless. You can use freely. Positioning prone is good, but it causes sudden infant death syndrome. So prone positioning has pros and cons. 30-degree elevation of the upper body is the only recommended thing. Right? But again, it should not be like this, where the upper body is elevated 30 degree, lower body again elevated 30 degree, like in a tortilla. It will cause reflux, right? Feeding small frequent feeds is the recommended feeding pattern, but only problem is if you are giving small frequent feeds, you might only feed the formilk. So the nutrition compromise might happen to a child. Then we come to disease and beliefs. The common belief among parents is not to give paracetamol for fever before a consultation. So they think, rationally, they think that when the child is having fever, it is easier to doctor to find the real problem. Well, the actual scientific reason is when the child is having fever and with rigors, whatever the clinical features we are going to find are going to be missed because he will be crying and shouting. Right? So as doctors, we have to tell that, no, give the Panadol, give paracetamol, get the fever down and come to us. We will have a child who is more comfortable, where our clinical examination will be more effective. Then not bathing after 12, as it can cause phlegm. Again, a wrong practice, because there's no practical basis. All our children come home after 12 o'clock. And after coming home, they need the freedom to play. After playing only, they will come back to the house covered in mud and dust. Now you have to give a bath. Okay? If you give a bath before 12, no point at all. Okay? So then after a fall, still it is practiced. Normally we put a cold compress, but there are some communities which still practice warm compress. So after a fall, you give a warm compress and there will be huge hematoma due to the vasodilatation. Right? Maybe they like the dramatic effect of a pump in the head. Right? So we have to tell that, okay, it's not the warm compress, it's the cold compress. Right? Then another belief is kakule adari, where grandmothers have a ritual where they will try to, whenever a baby is born, they will have curvy legs, which is normal because with long legs, if you have straight legs, you can't pack the baby in the uterus. Uterus is a curvy thing. Okay? So to pack the baby in the uterus, you need curvy legs. Automatically, it will recover. Right? So when a baby is born, they will have curvy legs, curvy hands, but by 1 year, they recover. Right? But in ancient people thought, no, we should correct it. Right? And this is different from infant massage, which is practiced all over the world, which is very good for children. You can apply some oil and softly and gently massage. That is different. Massaging is a recommended practice, but adherima means correcting the limbs is not a recommended practice. A lot of children end up in the orthopedic ward with fractures and torn ligaments. But then some people, especially very resistant grandmothers, might not agree with you. Right? For those mothers, I have an explanation. A lot of puppies, when they are born, their ears are drooping and they have curvy legs. But when they grow, their ears are straight, legs are straight. So whose grandmother corrected this? Right? So Baluachi doesn't come and adhere in, right? So in animal kingdom also, all they have curvy legs, but with age they get straight legs. Then Panudada, another common mistake. Whenever there is a hyperpigmented patch in the face, they will come and ask for worm treatment, and we also reflexively give worm treatment. So what is the rationale? Why do people ask for worm treatment when you have a hyperpigment patch in the face? No one has thought the worm is in the tummy, then the patch should come in the stomach. So how can a patch come in the face when you have a worm in the stomach? There's a rationale. There's an interesting rationale. The English term for most of these patches are Tinea versicolor. So what is the English term for Tinea versicolor? Ringworm. So when our people heard the word ringworm, the worm means panua. Okay, worm treatment. And panu dada in Indonesian language is Tinea versicolor. And we have a lot of Sri Lankan Malay population who are Indonesian descendants. So panu in Indonesian is Tinea versicolor. If you don't believe me, you can Google it. So when you Indonesian to English translation, when you type panu, it is Tinea versicolor. Okay. In Indonesia, dada means chest. So panu dada in Indonesian is tinea versicolor in chest. Okay? So whenever you have panudata, treatment is antifungal, not worm treatment. Okay? The worm, poor worm in the stomach has nothing to do with hyperpigment patches in the face. So disease and beliefs, another very bad belief in our community is why did your child get a febrile fit? If you ask this question, the mothers will take the blame. Right? This is a very wrong belief. Febrile fit is so before that, sorry, why is unadukaran parakuna a common term? The common practice is again put the blame on the mother, right? In our culture, we always put the blame on the mother. For example, mother with no milk, that's a very famous thing. Mother baths the baby and baby get ill. Mother breastfeed with wet hair, baby catches cold. Right? Okay. So this achalatapa chalatapa is out. Mother becomes chalatapi once you have a bath. Okay. So how do you break this? How do you break this? Febrile fits does not always occur with high fever. Some children have a very high threshold for fever. Febrile fits, very high threshold. Even if the temperature goes to 39, they will not get a febrile fit. Some children, unfortunately, they are not lucky. They have a very low threshold for febrile fit. Even with 38, they get a fit. Right? So, if a child doesn't get fit with fever, the parents should not get the credit. Right? The credit goes to the child. He has a high threshold for febrile fit. Right? If you take the credit, if your child doesn't get fever and fits, on the day he get a fit, you will have to take the blame. Okay? When a child get a febrile fit fever, do not blame the parents. There was nothing wrong with the parents. They were not late in bringing down the fever. Simply, that child has a low threshold for fits. So tell the mother, fever and fits, it's beyond our control. If he has a high threshold, he will not have a fit. If he has a low threshold, he will have a seizure. Right? Because if we can control, then none of the doctor's children should have febrile fits. Oh, especially the nurses, they come with all these charts, and when their own child get, they will put a chart, quarter hourly, they will give paracetamol, still you get a fit. Right? So febrile fits, nothing to do with parenting. Right? It's a natural phenomenon which you can't prevent. Children who get febrile fits will anyway get it. Children who are not getting will not get it. You don't have to take the blame. The other thing, why did your child has an upper respiratory infection? Yesterday he had a bath. Okay? Or in our culture, there's a thing called half bath and full bath. So Leli, especially the grandmas, Leli darwa bagatana. Therefore, you get a bath. Right? Again, this is a big misbelief. There's a small scientific evidence. If an infective agent is present in the house and the weather is very cold and you get wet, unnecessarily wet, yes, the blood vessels in the nose can go into vasoconstriction, and it might be a little bit easier for the germ to attack the child because all the immune reactants are not coming to the nasal passage because of vasoconstriction. So there is some scientific evidence. But having a nice bath today and getting ill tomorrow, there's nothing to do with the bath. You have got some bug. Okay. The real reason behind is this. Recurrent illness are part of growth and development and also important for immunity. Unfortunately, parents and grandparents refuse to accept that children are more susceptible to disease. Therefore, they try to find a culprit. The real culprit is the germ, which is not visible. Therefore, the visible culprit is bathing and commonly done by the mother, so easy to blame. See? So we are always trying to blame when our child gets ill, when in fact children should get ill from time to time. So that fact should go to the parent. Whenever a child is born, what I tell is, you have got a burden of joy plus 10 times trouble. Right? So don't expect only the joy. You have to get ready for 10 times trouble. Right? But our parents, what they want is only the joy, not the trouble. So when trouble comes, they try to find an unnecessary culprit. Disease and belief, another common one is any vaginal belief in a young girl, they go to the soothsayer and he will look at the time, puberty will be confirmed. Okay. We get a lot of children with one episode of vaginal bleed with no other signs of puberty, claiming that they have entered puberty. So if you are the practitioner, very simple, check the breast development and height spurt, because a child will go into puberty with, there's a pattern for puberty: breast development, height spurt, pubic axillary hair, finally menarche. Right? So very unusual. There are situations where pseudo puberty can occur with menarche. So if you are not sure, go for ultrasound pelvis to assess the internal generalia. If the ultrasound pelvis says normal uterus, prepubertal ovaries, then you can confirm that here the child has not gone into puberty. Right. Now last part, food, feeding and beliefs. So hot versus cold foods. Hot versus cold foods are common in many communities. There are some scientific evidence that some foods are a little bit hot because they release certain chemicals which make our body warm, and some foods release chemicals which make our body cold. So in ancient Chinese culture, hot was called yang and cooling foods were yin. Indian and Sri Lankan culture, usna foods and sita foods. In the Persian culture, gam and zad. African culture, kali and chakula baridi, cold foods. In Peruvian culture, the national dish is ceviche, which has cold and hot combination. So most national dishes, they use hot and cold combination. So we are not going to go against hot and cold foods. And what are these? Depending on the culture, some foods are cool, some foods are heating. You can see that there are a lot of fruits which are cooling and a lot of foods which are heating. Okay, so I'll give you some examples. These are available in the internet. So vegetables, there are cool and heat vegetables. Grains, legumes, no one has escaped. Dairy products, right? In some cultures, yogurt is cold. In other cultures, yogurt is hot. Okay. So what has this done is, we sometimes go and do unnecessary things, right, which are beneficial to the child. For example, avoiding citrus fruits during a common cold. Right? A lot of people will come and say, should we avoid citrus fruit? No need. Citrus is a cold food, but it doesn't cause common cold. Right? Citrus has vitamin C, and vitamin C is good. So most people will take vitamin C tablet, but not the natural vitamin C. Right? Then egg causes phlegm because it's a cold food. Well, wrong. Why this? A lot of people ask, egg and sema, what is the connection? Some children very rarely develop rhinorrhea after eating egg. And people think, all right, okay, every rhinorrhea is due to egg. Okay, so there's no rationale. Egg can be given to any child with phlegm, common phlegm, unless he has allergy to eggs. Then goat milk, good for asthma. What is the rationale? Goat milk in Hindu culture and even in our Sri Lankan culture is a hot milk, hot food. So asthma is a cold disease. So for a cold disease, hot milk. So scientifically we can't prove it, but traditionally the rationale is correct. But we know that a lot of children who are allergic to cow's milk are also allergic to goat's milk. Then belief, not good to feed after 6 p.m. Have you heard that belief? A lot of people, children, mothers come and ask, is it okay to give the night meal after 6 p.m.? Because there's a belief it should not be given at 6. In the ancient time, it is correct, because in the ancient time, children were fed using the oil lamps, kupi lamp, right? But now most of us have electricity. So now we can feed children after 6 because there's enough light, right? Yes, feeding too late at night, say after 8 p.m. or 9 p.m. is not good for the health, but definitely you can give a food, say somewhere around 7 or 7:30, because if you give very early dinner, the child will be hungry at night, and then he will turn to excess breastfeeding at night, which is also not a good practice. Then this is another one. Vatu bitrada hoda, kokul bitrada. Right? Mothers come and ask, Vatu bitrada enna, kokul bitrada enna. Okay, so in theory it is true. Vatu bitrada or quail eggs are good, but 100 grams. We'll take quail egg 100 grams, hen egg 100 grams, protein content slightly higher, calorie slightly higher, fat slightly higher, vitamin B12, iron, riboflavin significantly high. So quail egg 100 to 100, quail egg is much better than hen egg. This is theory. Now we come to practice. Okay, We'll come to practice. We'll go to Keels and buy 100 grams of fresh quail eggs. 448 per unit. Unit contains 8 eggs. 8 eggs is 110 grams. Okay. So to get this value of energy, you need 448 rupees. You have to eat 8 quail eggs per day to get 100 grams. To get the same 100 grams hen egg, this is again Lucknow eggs. One egg is 50 grams. One egg is 50 grams, so 2 eggs is 100 grams. And 460 for 10 eggs, so 1 egg is 46, 2 eggs is 92. So you can get the same value of 448 rupee quail egg energy for 90 rupees of hen's egg. Right? So what happens is, people will think quail egg is better. They will give 1 quail egg a day, right? Which is only 12 grams. Right? So if you take 1 quail egg and 1 hen egg is superior. Right? So if the mother want to give quail egg, you have to tell, better give 4 or 5 eggs a day. After 5 days, she will stop buying quail eggs. Right? Okay. I don't have any conflict of interest with GW fresh quail eggs. I'm giving the facts. Right? So finally, we come to the end of the lecture. I promised that I will finish by 12:15. I'm finishing a little bit early. So what is the most dangerous belief? Belief Ultra Pro Max. Both doctors and parents have this belief, and it's a well-known ritual also. Anyone guess? We have come across disease, food, illness, neonates, infants. The mother of all beliefs, or belief Ultra Pro Max. Every prescription is not complete without an antibiotic. It's the most dangerous ritual in pediatrics. And parents, they ask for antibiotic. High fever, antibiotic right? They think it's another antipyretic. So paracetamol, brufen, antibiotic. Okay. And what is the other ritual? Well, if you really need an antibiotic, write 2 antibiotics when only 1 is really needed. This in pediatrics is really harmful than all the beliefs and rituals we have discussed during the last half an hour. Okay, 2 antibiotics for 1 illness. Very rarely we give in our HDUs or in our ICUs when the illness is very out of control. But for some common lower respiratory infection, you should not give 2 antibiotics. By giving 2 antibiotics, we are telling only 2 things. But that you are not confident of your own skills. If you are confident, you should know what, when and what to write. And if you are confident, you should be able to attack with 1 antibiotic. Okay? So don't show your lack of confidence by putting 2 antibiotics. No, that should not be the practice. You have to treat, see whether it's antibiotic is needed and treat, right? So we will try to reduce this Ultra Pro Max belief from the practice. It's good for the children. I don't have any thinking about adults. It may be different, but definitely for a lot of our children, they will do very well with only 1 antibiotic. Okay, so with that, I would like to wind down, and I'm happy to answer any questions if I know the answer.